Hello, thank you for taking the time to join me here today to learn a little bit about the Florida Family Leader Network. And if you are registered for our 4th annual summit coming up shortly, I hope this short orientation will help put the work that we are doing into some context, and it will help you enjoy the summit a little bit more. I am Angela Miney. I'm the family partner at the University of Florida Pediatric Pulmonary Center, and I am the coordinator of the Florida Family Leader Network, which we commonly refer to as the FFLN. I come to this work as the parent of 2 grown daughters now, but when my younger daughter, Catherine, was 6, she was diagnosed with what turned out to be a pretty complex medical condition. I'm happy to say that she is doing well now, but as I often say, I was dragged kicking and screaming into this world of family professional partnerships. But I'm happy to say I've met some great people along the way and hope that I have some valuable information to share with others. So for today, I really just want to talk a little bit about the principles of patient and family-centered care that guide this work within family professional partnerships and keep me grounded and passionate actually about doing this work. I want to describe how family and youth leaders are engaged in family professional partnerships, specifically people who are engaged in serving children and youth with special health care needs, particularly in Florida, but I know that there are many of you who are joining us at the summit in other parts of the country, and I know that you also have valuable experiences to share, and I hope this orientation, as I say, works. And then I'm going to describe for you the Florida Family Leader Network, which I see as a model that strengthens family professional partnerships. Just a little bit about definitions, because I realize that as I'm speaking, I use a lot of these words interchangeably and sometimes don't use the full phrase. And so just to remind you that when we talk about the FFLN, and family professional partnerships, that we are talking about family and or youth leaders, or sometimes we refer to them as partners, because as you will see later on, I believe that we are partners in improving systems. But we're talking about people who are using skills that they have acquired, either taking care of themselves or in taking care of their own children, to now work with and advocate on behalf of other children and families. And that can be both at the individual level or at an organizational level. And I do give some examples of this a little bit later on. There are many people who support us and help us in this work, and typically we refer to them as the professionals in fields who are engaged in work with children and youth with special health care needs. I like to see family leaders and youth advocates referred to as professionals also, so I avoid segregating us into family and professionals, and rather I like to talk about the champions who support us in this work. And then, of course, there are the emerging professionals, and many of you are listening to this today, and quite honestly, you are the next generation who are going to continue on this work and continue to include the patient and family voice in the work that you do. And then when we talk about children and youth with special healthcare needs, we are typically talking about 20% of the pediatric population, and we define those as children who require services beyond what are regularly required and offered to children. And the This acronym CYSHCN, or Children and Youth with Special Healthcare Needs, is an umbrella term that includes children with disabilities, medical complexity, and chronic illness. Just a brief note about pediatric pulmonary centers, because I want to sort of put into context how the FFLN emerged, and sort of talk about some of the partnerships that we have. As I said earlier, I'm the family partner with the Pediatric Pulmonary Center. Pediatric pulmonary centers are funded by a grant from the Maternal and Child Health Bureau. That's federal funding. For any of you who are familiar with the term block grants, which of course if you are, you know that they are awarded to each state. And so the funding that the pediatric pulmonary centers get we are what's known as a SPRANS grant, which stands for Special Projects of Regional and National Significance, and we are tied to the block grant. So there are 6 pediatric pulmonary centers in the country. You can see here geographically where they are located. The University of Florida in Gainesville. There's one at the University of Alabama in Birmingham, out in Washington State, 2 now in California, relatively new centers, one at the University of California in San Francisco and Children's Hospital of Los Angeles, and then at the University of Arizona. And the reason why I mention this is because pediatric pulmonary centers are strongly encouraged to collaborate with our state Title V partners and with other MCHB programs within our states, and we are also encouraged to collaborate with one another. So in terms of Florida, the other Maternal and Child Health Bureau funded programs, I'll now refer to them as MCHB, in Florida are the Center of Excellence in Maternal and Child Health Science and Practice at the University of South Florida in Tampa, at the University of Miami within the Miller School of Medicine. There is the LEND program, which is the Leadership in Neurodevelopmental Education. I'm probably getting that wrong, but the LEND program, and then ourselves at UF. And as I mentioned, our Title V partners are at the Florida Department of Health within the Office of Children's Medical Services. And then in terms of geographically, I wanted to put in a map there so that you can see that our programs are spread throughout the state. And obviously these days, it's a lot easier to collaborate with one another than it has been in the past. I mean, as you all know, we've all become so used to using technology now for collaborations and connecting with one another. But typically it has been challenging for us because of the size of Florida to get us all together, and the significance of that you will see in a slide or two. I wanted to talk for a moment, as I said, about the principles of patient and family-centered care. And I love this icon of the woman and the man doing a tango. And this actually icon was used on the cover of a special edition that the British Medical Journal did several years ago now, but the entire edition was dedicated to this notion of embracing patient partnerships. And I really like this visual because I think what it does is, you know, for any of you who know anything about dance, you know that the tango is a very complicated dance. It is very beautiful when it is done well, but it takes practice and a lot of practice to perfect. And I think that really does describe this whole idea of us switching to a patient and family-centered system of care, and this notion of embracing family professional partnerships and including the patient and family voice in everything that we do. I'm not going to read this definition. It is one that I typically use. It's from the Institute for Patient and Family-Centered Care. I have put a link to their website on a slide at the end with some other resources. But really what I want to emphasize here is this idea of mutually beneficial partnerships. And as a caregiver, a patient, a parent coming to this relationship and wanting to be involved both at the individual level in my daughter's care and now involved in systems change, I believe that, you know, there is benefit in bringing all of us together. There's benefit for you as practitioners. There's benefit, obviously, for the patient and families. And then also going along with that idea of partnership, there is also responsibility on each of us who are part of the relationship. So there are 4 principles that we talk about when we talk about patient and family-centered care. And the first one is dignity and respect. And typically, the Institute for Patient and Family-Centered Care refers to this around healthcare providers honoring the patient and family, their perspective, where they're coming from. I do believe, as I said when I talked in the previous slide, that if I want to be a partner in my daughter's care, that I also need to respect the expertise that you're bringing to this relationship and to the care that you're bringing to you're giving to my daughter. And so, as I say, there's responsibility on both sides. But if we ground our relationship in that notion of dignity and respect for the values and beliefs that we are both bringing to the relationship, that is a really good starting point. The second principle that we talk about is this idea of information sharing. And of course, you need to share information with us appropriately so that we can participate in the care of our loved ones. Equally, I need to share information with you. I mean, in my daughter's case, for example, she spent most of her time with me. She wasn't in hospital 24/7. She was at home with her family. And so we needed to be able to be good historians when we went for clinic visits, for example. And so we need to be able to share information with you appropriately so that you could give her proper care. But equally, in terms of decision-making and being partners in that decision-making, I needed to have information given to me, explained in a way that I could understand, that enabled me to participate. And participation is, on this individual level, is the third pillar of patient and family centeredness, where, you know, if we treat one another with dignity and respect, we share information appropriately, then we are able to participate in the decision making at whatever level that we choose. And I think that that's also very important, that there are many patients and families who don't particularly want to participate at perhaps the level that I was keen to participate in my daughter's care. And I think we also have to honor that there are many reasons why people don't participate. And people participate at different levels at different times. But this whole idea is that we want to be partners in care, and there are certain things that we all have to do to make that a successful partnership. And so really what the FFLN is engaged in, and what I am very much engaged in now, is this collaborative effort where I and others like me, and perhaps you are also involved in changing systems that serve children and youth with special healthcare needs at this systems level. And so whether that is in program design, whether it's in education, whether it's trying to improve how care is delivered to people beyond my daughter, for example, this is the level that family leaders, family partners, youth leaders, that we want to be engaged in this level. And that is a much smaller population of people, for example, than all of the caregivers of children with special health care needs, or all of the patients who are receiving treatment across the country. And so the FFLN really is a network that is geared towards family leaders and youth advocates, and really how we can enhance our skills at this collaborative level. And many of you, again, who may be listening to this, you are, as I said, you're a family leader who is using the skills that you acquired taking care of your own child to now help others, either on that one-on-one basis, but frequently also at this programmatic level. So let us skip gears a little bit, and I'm a very visual person, so when I talked earlier on about that icon of the two people doing the tango, and sort of that as a description for patient and family centeredness, this also is nothing about us without us, is really a mantra that is used within the world of patient and family centeredness to help you think about incorporating the patient and family voice. And so the idea is that you don't do anything in terms of improving or changing systems around taking care of children with special health care needs without including your clients, patients within that conversation, however you want to describe us. So I'm going to just describe some examples of how we are included both locally within the state of Florida, and then some national organizations. And these are by no means exhaustive, and you could probably add many more of them yourselves. But at a local level, typically patients and family leaders are now participating on advisory councils, whether that is in a community agency. Typically, I have been involved in several advisory councils at UF Health. I've also participated on several committees, quality improvement committees, in particular patient satisfaction, and my whole charge on those committees and on the advisory councils is to share my lived experience of what it is, in my case, getting care for Catherine at UF Health, and then using that experience to see if we can improve it for other people. There are many people who are involved in education programs, family leaders who are asked to share their experience with emerging professionals, to try and have emerging professionals think about what it is to walk in the shoes of the parent or caregiver of a child with special health care needs, and then how you can use that information when you come to developing programs or improving programs when you go into your work setting. Many organizations have mentorship programs, which are where you have somebody who has more experience of raising a child with special health care needs, trying to bring along and mentor a family who are just experiencing this either, for the first time, or they're in those early days of trying to navigate systems for children and youth with special health care needs. And then there are many people now, it's growing more, who are, like myself, engaged in staff positions alongside other professionals, participate as a full member of the team, and get engaged in regular activities within an organization, and then special projects as well. Specifically within Florida, some of the ways that patients and families have been able to participate at this program and development level, for example, within the Florida Department of Health Children's Medical Services, we have been invited to give input on the 5-year needs assessment. There was actually one done back in 2019 or into 2020. We participate on work groups, in focus groups. There is a very large initiative that is being spearheaded by Children's Medical Services. It's a quality improvement initiative. I know I'm using a lot of acronyms here, but Children's Medical Services, their Learning and Action Network is in many of the Florida hospitals now. And then the Children's Medical Services are partners with the University of Florida in developing this Florida Family Leader Network, and have been great support for us. Also within Florida, the Family Voices chapter of, in Florida, it's known as the Family Network on Disabilities, provide training, education, support to a vast number of caregivers and youth within the state, and have some wonderful programs, and I have included a link to their website here for you to explore. And also for any of you who are not familiar with Family Cafe, which is another Florida-based organization, not so much these days only targeting children and youth with special healthcare needs, but I would say encompasses the adult population too of people with special healthcare needs. Family Cafe hosts the largest disability conference in the country each year, and also does other activities throughout the year in terms of working with youth and providing space for dialogue, very involved in advocacy and supporting families. And then nationally, as I said, this is by no means an exhaustive list, but I just wanted to give you some idea of what organizations are very involved in incorporating the patient and family voice. So for any of you who are interested in research, PCORI does nothing these days, doesn't fund any projects these days without patients and families being included in all steps of the research process. And then I have just provided a list. My own go-to when it comes to patient and family centeredness is the Institute for Patient and Family Centered Care. The Beryl Institute is very clinic and hospital based. AMCHIP, the Association of Maternal and Child Health Programs, is more public health focused. AUCD, the Association of University Centers on Disability, I would say focuses more on people with intellectual disabilities and research that is going on in universities. And then many of the disease-specific foundations, I just listed the Cystic Fibrosis Foundation here because I'm familiar with the work that they're doing, but they are big supporters of including patients and families with cystic fibrosis in the development of their programs. And then the American Academy of Pediatrics are also incorporating the patient voice into many of their initiatives, particularly their medical home initiative. So again, switching gears now to just tell you a little bit about the Florida Family Leader Network and how it emerged. And as I say, to try and give you a little bit of context for the summit that you will be attending. I wanted to just remind you that the FFLN emerged as a collaborative project and emerged from discussions with the MCHB programs within the state of Florida and our partners, our Title V partners at the Florida Department of Health Children's Medical Services. And as I said, we are very strongly encouraged to collaborate with one another, and we've been doing that over many years through our programs. This is just a little timeline of how the FFLN emerged. And as I mentioned, we are strongly encouraged to collaborate with one another, the MCHB programs. And so we typically meet either in person or virtually annually, sometimes a couple of times a year, to discuss our programs. We all have the same overarching goal, which we honor the goal and the mission of the Maternal and Child Health Bureau, but because our programs are focused on different populations or on different areas, we tend to do something very slightly different, but it's always good for us to come together and find areas of common interest and collaborations. And the FFLN actually emerged as from a conversation back at a meeting in 2016, where we were discussing this concept of family leadership, family professional partnerships, and including the patient and family voice in everything that we do. And really at the end of the 2016 meeting, it was demonstrated that there was really a hunger for family leaders to stay connected with one another. We had a number of family leaders, both from the MCHB programs, but also from other community agencies, attend our 2016 meeting. And it was very clear that, you know, people wanted to stay connected with one another and were feeling somewhat isolated in the programs that they were currently working in. And I can say that through 2017, we continued some discussion with the Florida Department of Health Title V office on how we could continue these connections, and with some funding and with the support of our Title V office, we were able to host our first in-person summit in 2018, where we had about 70 attendees, and I'm going to say more than half of them were family leaders within the state of Florida. And I mean, it was very clear at that meeting that all of these family leaders were operating at a very professional level within organizations, not necessarily knowing the other people in the room, and we're very keen to continue to collaborate outside their own agencies and also to work with the champions that they met at the meeting. And so we were able to host another in-person summit in 2019. The overall goal really of the FFLN is to provide those networking opportunities. And then there's a secondary goal of helping family leaders and youth leaders increasingly develop leadership skills so that we can participate more in these collaborative and programmatic at a programmatic level. And of course, in 2020, we all had to switch very quickly to a virtual format. But what that did was we were able to have a lot more people participate, and also people around the country. And I'm happy to say that in 2021, we also, well, I'm not really happy to say it, but it would have been nice to have met in person, but we decided that we would have another virtual meeting in 2021. But happy to say that that means that we can continue to invite more people and also invite people from across the country to learn about the work that we are doing, and also to learn about what is happening in the country. And then in between each summit, we also host a spring webinar series, which is focused on leadership development. And then we are also doing some other networking opportunities, and I think I talk about these on the next slide. So as I said, our focus is on networking and on leadership development. And based on what the group wanted to do, we have a private Facebook group which has around 160 plus members. We have an email listserv that serves about 260 members. And these are not just all family leaders there. These are also champions and emerging professionals. As I mentioned, we host an annual summit. We do some spring webinars. We are able to host recordings of some of those webinars on our website. You can see there's a link to our website at the bottom of each of these slides. And in 2021, we have been piloting a networking series of sessions on a monthly basis, where we invite, really send out an open invitation As I said, it's a pilot program, so it's not yet open to the entirety of the FFLN, but we are actually piloting this with our executive group, which is an advisory group, which is actually quite large. And so we are inviting that group to come together on a monthly basis to really network with one another using this Jack Canfield mastermind model. And it gives people an opportunity to identify the issues that are important to them at the time. And as I say, you know, we sort of learn from one another through conversation, and we're hoping that that pilot program will be made available in 2022, if not sooner, to the entirety of the FFLN. And in terms of deciding what our leadership development skills training looks like, or the topics that we focus on each year, we do an annual needs assessment where we identify the topics that our members are interested in. We also focus on the core MCHB competencies. For any of you who are familiar with MCHB and their leadership competencies, you know that there are 12 of those. And then, of course, we also sort of stay abreast of those national concerns. We probably all know that we're focused on a lot on burnout and resilience these days as a result of the pandemic. Again, this is just a sample of some of the organizations that are represented within our network. And I'm happy to say that that grows every year. And we have a very good cross-section between education, clinical programs, private foundations, and then agencies that serve children with special healthcare needs. And so our network is not only composed of people who are family leaders, champions, and emerging professionals, but they're representative of a lot of organizations within Florida as well. So what can you expect at the summit, which is coming up very shortly? Well, really what we want to do is what we do every year is we learn together, and we want to bring people from across the country, so presenters who are both local and national, who will share both their lived experience and their expertise. But what you will also get the opportunity to do is participate in a lot of discussion where you can also share your expertise and your lived experience, and I would encourage you to do that. Everybody who is registered for the summit has a story to tell, has lived experience. This is not just confined to family leaders. Everybody has been a patient at some point, knows somebody who's been a patient, and so we all have something to share. So you're going to hear from national and local family and youth leaders, or young adult leaders, I suppose I should refer to them as. You're going to learn how to develop an impactful story. We often talk about our elevator speech. We're going to do a little bit more than an elevator speech, but learn how to really make an impact when we get our 5 minutes to talk to a group of leaders. We're going to have a session on reflecting on living loss, and how, when we understand living loss and how that has impacted ourselves, how then we can better serve others. We're going to ask you to participate in a focus group for some work that we're doing within Florida, so that we can strengthen these patient-centered partnerships. And very importantly, we're going to hear just briefly from a dad who is going to tell us about what keeps dads awake at night. And then, of course, as I mentioned, networking is very key to what we do. And we hope that we will give you enough opportunity to network with one another. We are also using a conference platform, WOVA, which will allow you to connect with people while you're at the summit and beyond, but sort of outside the traditional sessions. So just my final thought, and I know that there are some of you listening to this who are not attending the summit, and I apologize for that. I hope that you will be encouraged to participate in a summit some other time. But you know, this orientation is just to try and give some context to the FFLN for those of you who are attending the summit. But these final thoughts apply to whether you're being at the summit or not at the summit. You know, family leaders, youth leaders, we just see the care for our children with special healthcare needs through a different lens. And it's not that we have the answer to everything, but we just want the opportunity to give our input, because we do have a unique perspective that when you are a champion, perhaps immersed in a particular system, that it's just hard for you to see what it's like for somebody from the outside coming into the system. This work is very hard. I'm a lot grayer now than I was when I started doing this work several years ago. There are no easy solutions, but we have to keep working at it, because we want to give our kids the best possible chance, and we want them to be successful in their lives. And to do that, we just want to be part of the conversation. So this is just a list of the resources that I had mentioned throughout this presentation. You're welcome to explore some of them. I hope you will find them helpful. And finally, I would just like to say to you, welcome to the Florida Family Leader Network, to our 4th annual summit, which is scheduled for the 22nd and 23rd of September. And I'm excited to have the opportunity to meet you at that. And with that, my contact information is also here. Please reach out if you have any questions or concerns.